Center over in Newport Beach. I'm going to wait for some more people to come on, but I'm going to talk a little bit about filler, about how I do filler, because it's a little bit different than traditional. A lot of people will just do hyaluronic acid filler where they try to actually just bring in things that draw in water. Whereas instead, I try to focus on more collagen stimulating products. Typically, I use products like Sculptra, Bellafill. Those are my usual go-to products, or Radius is a really nice product as well. Those are all products that again stimulate collagen. They do give you a little bit of volume, but more importantly to me is that they make the skin quality better, and over time it actually looks a little bit better. Whereas I feel like sometimes with hyaluronic acid filler, sometimes what ends up happening is that over time it may not actually look as natural. Now, of course, I still do some hyaluronic acid filler. You can see, for example, in some of these patients where we're looking at the lips, for example, we can't use collagen stimulating products for the lips, but we can do it in areas like the cheek, even along the jawline and along the chin. Those are actually areas where we could combine it sometimes with a collagen stimulating product, so a hyaluronic acid filler with a collagen stimulating product to get a little bit more longevity there, again to make the skin quality better, and over time it really does continuously stay there. It looks a lot better than when we first started. That's really one of the big hallmark differences when it comes to doing collagen products compared to just traditional hyaluronic acid filler. But when it comes to more like structure support, things like the jawline, for example, that is an area where hyaluronic acid filler is good because you can just get a really nice lifting effect over here. And the nose, I also do hyaluronic acid filler, works incredibly well for my patients because we can improve the hump that's there with something like a little bit of HA filler. Usually I prefer non-Vicross linked products, so something like along the Restylane line of products is really good. At least from my end, I usually love that because it's easy to dissolve if we run into problems, and on top of it, it doesn't really tend to shift or anything like that. So I think that's what ends up working really well for that. But for patients, hi Joey, how's it going? For patients who are interested in improving some of the volume loss, but still want to have a more natural look, there is a way to do that. Really, it's not that you have to actually just get this puffy, overdone look. Whenever I talk to people about doing filler, they get really concerned about that. Understandable. I do see it myself. I know full well what's happening out there. I've talked about it before, that occasionally I'm going to walking around the malls, for example, things like that, and I'll see people who are really overdone. And so instead, if we could actually do this in a way that's natural, looks untouched still, it's really rewarding for patients and obviously myself, because if I run into you, I want to make sure that you're looking really natural and the work looks really good. So you can see also I'm showcasing for the under eye area too. I tend to use, again, more like Restylane category of products. That's usually a little bit better because it doesn't draw into as much water, easy to break down if you run into problems. So I think that's really good. Yaya Deput is saying how to get rid of red spots due to dry skin. So you may want a product with urea, so rough and bumpy works really well. So you could try considering that. Just add it's called Cetaphil rough and bumpy. You could try considering that option, and then also really making sure that you're not overly drying the skin in general. So you may want to use like a Vanity cream, works very well. So you tend not to really want to irritate the skin too much. If you are going to use an exfoliant, then you could do it just like once a week, where you can use a glycolic acid, really just about like 8% glycolic acid once a week works really well. So I know I missed a few people on here on the different platforms, so feel free to ask again if I missed any questions over here. But I wanted to showcase just the process. A lot of people are coming in for Christmas time. This is the time when everybody's coming in to get filler done. They're already thinking about the holiday time and kind of restructuring some of the areas that they lost some volume. We had a lot of people that were on Ozempic and the other GLP-1 inhibitors, and they lost some filler, they lost some volume. Lost some of the fat that was in their face, and lost a little bit of structure. So that's what I want to showcase, that there is an option to do it. We could just do it with hyaluronic acid filler if it's in the right spot, or we could do collagen stimulating products. So all those things could work out depending on what's happening with your volume loss, or just what aesthetic you're trying to shoot for. So some people, of course, I have a lot of people, especially a lot of men, who want to work on their jawline, for example, and just want to build it out a little bit more. Just got to get like that. What I always talk about, becoming the best version of yourself, and in their mind, it's having a very strong jaw. So we could do that. I don't want to make it look ridiculous, though. It has to be proportionate to your face. So we're not going to give you this big squared off look if your face and even your neck doesn't fit it. Some people have a tinier neck, and if you give them a really big, wide jaw, it's not going to really look that great aesthetically. So you got to look at all those things. Here's a patient that I showcased. You can see his side profile there with his jaw. It's subtle. It works really well. Here, take a look at that. Really great result. Worked on his chin and his jawline over there. It worked incredibly well there. So we could do it. It's just a matter of being careful with the product you're using and not overdoing it there. Kumali saying, do you have any recommendation for closed comedones while in a cure? Well, you may actually benefit from a light product, like something like azelaic acid could be something that we may want to do. Let's take a look and see. Sometimes even while you're on a cure, if it's really a problem, I could do like a glycolic acid, maybe once a week. Glycolic acid could be a good idea too. We'll just have you hold off on that about 5 days before we do the cure session, though. But glycolic acid could be a good way as well. So talk to our office. I have a few options for that. If it's really it's still consistently a problem, then we may do a lower dose of a retinol. Then that could be another way of solving that, though. But initially you may have those closed comedones like you're asking, but over time it does get better and better. Will a cure help with closed comedones? Yeah, it does. It does actually work very, very well with closed comedones. Usually that's something that's not much of a problem after just a few months of doing the cure laser. There's actually, I've had lots of follow-ups. People are really interesting because they used to have really big cystic acne, and then 3 months out, they just maybe notice 1 or 2 pimples, and it really could be distressing for people because, it's that 1 or 2 pimple before you did the cure wouldn't have bothered you, but now it's you're still stressed out about it. But over time, it continues to get better, and we do have to always remember that there's a bacterial component that we want to solve. So we're doing that as well. We're going to work on your bacterial component with topical antibiotics, for example, oral antibiotics if it's necessary. And then at some point, we may start a low dose of retinol or retinoid. So usually my go-to is like Tazorac or Tretinoin, just low dose of that. That actually works out really well too. So it just sort of depends on how much oil production you have and the bacteria that's on the surface of your skin. Anna's saying, is it true that CMOS gel can help with acne? I've seen that around. I haven't tried it myself. Honestly, I've tried multiple different things before in the past, but the problem is that you end up going down this rabbit hole where you waste a lot of money and time on trying a bunch of stuff that ends up not really helping, and sometimes it can make it worse. Diana is saying, hello from El Dorado Hills. It was nice meeting you yesterday. It was really nice meeting you, Diana. Really, really nice. Thanks for driving all the way down there from El Dorado Hills. Really appreciate it. That was actually a 7-hour journey that she did to join me yesterday. And we did a really, really great acne scar session yesterday. I can't remember if you let me share your photos. I think you are going to let us, so probably in about a month or so, we'll be able to showcase something from you. Appreciate that, by the way. Do you have appointments for tomorrow? Not tomorrow, but you can always go on my website. There's people cancel, move patients and things like that. So you can always go through there and try to schedule something, and we'll be happy to see you. And by the way, everybody knows now, I don't think we announced it just yet on our page, but everybody knows that if you spend $100 on your consultation, you do get $200 back that'll be towards your treatment, just so you know. You spend $100 for your consultation, you'll get $200 back that goes towards your treatment for acne scars. So just go ahead and set that up there. Medina's saying, hi, Dr. Qazi, my skin gets a breakout here and there. Would I be ready for acne scar treatment? Well, it depends on how much oil production there is, really how bad that the little acne is. Hopefully it's under control. If it's not that bad, we probably could be able to start going with that. How is tretinoin? Tretinoin is good. I just start lower than a lot of people. I start at 0.025%. And then a lot of times I even mix it with the moisturizer for like 2 or 4 weeks. And then we may ultimately back off on that and just go directly with it. But I go pretty light. I've talked about this before, that sometimes I think that people overly dry the skin. And with acne prone skin, if you're overly drying the skin, you could end up actually causing it to rebound and cause more oil production and then more acne afterwards. Edwin saying, how to get rid of acne scar for beginners. I'm just starting. Well, I talked a lot about that yesterday as well. I could showcase that a little bit over here. But it depends what kind of scars you have, Edwin. We can kind of go through that. Maybe I'll show you some results of someone with that. What can I do about hyperpigmentation under the eyes, not hollow? Really, the Pico laser works really well for that, really well for the under eye area. So that's probably one of the best options if it's just really true hyperpigmentation. That's what I tend to recommend. I did my consultation. I only got $100 toward the treatment. Can I get another 100? There's always something that you probably even got involved with too. There, remember, you also get going forward. You also always get the lifetime warranty. So you have a lot of different perks with that. You got a lot of ththings. We just are announcing this for right now, really for the fall and winter time, just to try to get that going. But I'm sure. When the time comes, there's a lot of different things that we ultimately do for helping people out. Robbie's saying, so 0.025 is good to clear acne. Not 0.25, but 0.025 is what I would usually start out with, though, just to go really, really low dose. And period, what was the consultation, by the way, that we did? User 10 saying, do you have before and afters of Pico laser for under eyes? I definitely have it in the office. I'm not sure if I have it on my computer right now. I'll try to take a look. Sipin is saying, thoughts on Genius RF microneedling. So someone yesterday did, I think, 6 sessions of that. Didn't find it helped at all for their scars. I don't really think it helps too much. Oh, period. Yeah, this is for that discount is for the acne scar sessions. So it goes towards the acne scar stuff. So just so you know, so the $100 that you're going to spend for your consultation, you're going to get $200 back towards treatment, but that's towards the scar treatments. So just so you're aware of that. I'm going to try to take a look and see. Anybody want any other photos? I could try to pull them up there right now. I'll try to see right now on my computer if I have any Pico under eyes. I definitely have some really, really great results for pigmentation. I'll try to see if I have anything for the under eye here too. I'll try to see if I can do that right now. I'll pull up some pigmentation photos. You guys know I love pigmentation stuff, so yeah, you're hitting right at the thing. I am also going to be showcasing more things for hypopigmentation really soon too. I'm getting a new device that's going to help out really, really well, rapidly start clearing up some pigmentation, especially with for patients that have vitiligo. Going to really help with that, and also post-inflammatory hypopigmentation as well. We're going to have that as well for people. So I'm going to show this as a really nice result over here for pigmentation. Take a look at this. I still see this patient, really, really beautiful result, improvement of her skin. I want to show you this. This is really nice. So this is with a patient who's of Indian descent, subcontinent descent. You could take a look and look at that significant improvement of her melasma. Really, really difficult case because we're trying to break up pigmentation without taking away her natural skin tone. That's really a fine balancing act that we have to do in order to do that properly. And we did it. We achieved that. We achieved that so many patients. We've done more than 14,000 patients at this point. I actually, by the end of this year, we'll have the newer numbers, but it's a lot of there's a lot of patients that we've been doing now for about 6 years now. I've been doing a lot with pigmentation. And it's something I really pride myself on, being able to treat all skin types. Very few people will treat all skin types. A lot of people will say that you can't touch someone with this skin type with lasers. This kind of patient is walking around with hyperpigmentation, and people really end up not giving them many options. A lot of times they're just throwing creams at them, anybody who's been doing creams and with melasma, they'll tell you that it doesn't help that much. It doesn't help for very long. Ends up coming back really easily. The way I do this, I want to suppress it very, very well for 6 months, and then I have you on a maintenance program afterwards. Very unlikely to have it come back the same way it does, especially if you're using sunblock, especially if you're really being careful with the sun. I don't have melasma, but I myself, when people see me out in the sun, I have like a solar shield a lot of times. I'm like just tons of sunblock. I really do think that we just have to make it more normalized just to do that. Just just the way at one point face masks were normalized. Now suddenly everybody says no more face masks. But we all know that influenza, for example, is is airborne. I know that people say that it's only droplet precautions, things like that. But you go in the hospital, we know that like in the room, it really is expected that it is potentially airborne. And so especially in small distances. So why not just protect ourselves, be really, really careful. We know COVID is as well. So it's just like, let's be like mindful of that, especially as it gets worse and worse. So, I'm when I do procedures, I'm always wearing a mask. And I think we just have to normalize that. Normalize wearing a mask. Somehow in New York City now, they banned masks apparently, walking around. So I don't know what's going on with that. But I think a lot of these things should be normalized, should be the fact that if you need to, if you feel like this is something that's going to help you keep you safe and keep another person safe, why not? Why not do that? It's not going to harm anybody. So it's like, I don't understand that. Be a good neighbor and help out people. Sipan is saying you could only use 2 cream serums. What would it be aside from sunscreen and tretinoin? If you could only use 2 creams and sunscreen, well, sunscreen and tretinoin are probably the 2 creams that I would mostly use. Also, our pigmentation cream works really, really well with that. Sam was saying, hello doctor, I'm scheduled to do a TCA with you. I postponed because I heard scars will look worse before they look better. Your team failed to share with me recovery photos of TCA cross. Well, we don't have too many photos of people that just do only TCA by itself, of just going forward with that. People don't tend to just show photos every single day from TCA cross. So I think that may be the reason why. We have a lot of photos of people who TCA with laser, but I really don't have issues of scar widening. I really don't. It's not something that I'm concerned with at all. And I know I've seen your message before about you being concerned about that. I know you've seen people that are worried about those things. I could tell you even very, very clearly on here on live that we don't have patients that have prolonged widening of their scars. Really, it just doesn't happen like that. It's just like there's a period of time sometimes where it could be about 3 or 4 weeks where sometimes it gets a little bit wider and then it contracts. Very rare for that to happen, but sometimes it happens. More likely actually with excisions, it could happen for a short period of time and then it contracts again. But TCA cross by itself doesn't really happen like that. So honestly, though, I do think though that there's a point though sometimes where we have to sort of just have like a trust process, with these things, where it's like, you have to have like the right state of mind and really feel comfortable about doing these kind of procedures. If I'm saying to do TCA with laser, there's a real reason why. I don't say it for everybody, but a lot of times I want to soften out the edges of the scar. You're going to get a superior result when you do it that way. I'm not so much of a fan of just like picking and choosing like completely, unless we really have a proper discussion and seeing what you need to do. I understand sometimes for people that need to do things for like volume, things like that, we'll do more like filler, like Bellafill or Radius Sculptra later on in the future. But when I do like the combination session, in order to get the results that I try to do, I try to maximize that under a single session. I'm doing that on purpose to really maximize that. That's what I end up doing. I want to make sure that we can really wake up your collagen so you get really, really great results. That's why I tend to do it there. Sipin is saying, your favorite treatment for skin brightening and lightening. My face is darker than my neck and body. Go to our page. You can actually just, I do a lot with the Pico laser. It works incredibly well for that. And you can also get our pigmentation cream directly from our page. You can go to drqazi.com and then go to get our pigmentation cream. It's not hydroquinone based. It's safe for you. You could use that. That could end up being a great option for you. Just try doing that actually. Let's see here. I know I saw a bunch of people saying, do you prefer mineral or chemical sunscreen? Good question. I think that if you're worried about the possibility of chemicals, sunscreen, having any, carcinogen, anything like that, stick with the mineral sunscreen, but just reapply that constantly. I personally think that for some patients, especially melasma patients, you do need stronger sunscreens, which tend to be chemical sunscreens. Mesoaesthetic line is really great for chemical sunscreen for melasma patients. But that being said, I think that if you're finding something with iron oxide, zinc oxide, titanium oxide, you could end up getting a really, really great coverage. The problem is sometimes it does get a little bit more pasty when it's more of the traditional like white cast. But actually, surprisingly, at least with zinc oxide and titanium oxide, Neutrogena actually makes a really nice product actually now. It's new. I think it came out a few months ago. I'm not sponsored by them, just so you know. I'm not saying that just to go out there to buy that. I'm just saying they actually have a really good sunblock. Actually, it's a nice tinted sunblock. I don't think it's like the best, but it's also like it is very affordable. A really nice option for people. It's a physical sunblock. Works really, really well. Let's see. Sophia is saying, do you have any thoughts on MiraJet, CureJet type of laser for needle-free transdermal drug delivery? It has become more mainstay in South Korea. Well, it's funny. I actually did try a device like that. I'm not going to mention the name of the device, but I did try a device, and it was really, really disappointing. I actually first, I'll tell you the whole story. Actually, I'll tell you the whole thing about this whole thing. So, needle-free device. Actually, when I was a few years ago, I was literally right before COVID time. Actually, I purchased a device like just maybe like a few months before COVID really went wild, and I was excited about it because I was trying to make sure that PRP injections could be really needleless and it could be really as minimal as possible with pain. But the problem was that as I was doing it, I was learning that it wasn't penetrating as well as they were saying it was. I actually tested it out myself independently, and it wasn't penetrating well. And I was shocked because I had actually asked a physician about this device before I purchased it. And he said, yeah, it's great, blah, 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 blah. And it turned out he was being paid by the company. He was a company spokesperson, and I think he was even an investor or something like that involved with it. It was really, really unfortunate. Was never told about this, and he was just a salesperson. And ultimately ended up being that this doctor was just a salesperson and sold me this device that wasn't pushing product in there. So I'm really skeptical of it, to be honest with you. Really skeptical of it. There are a couple of things. I think CureJet may be one of the ones that could penetrate well, but otherwise, I did get, I think the one I was using was I didn't realize it, but I think it may have been a bit of let's not say knockoff, but I think that they copied off of something like CureJet. Let's see here. Yellow saying, I missed her question. What's the thing here? So Yellow saying, what about broken capillaries? I previously had V-beam and nothing worked for it. Well, the thing is that with your skin type Yellow, you are FITS 5, if I remember correctly. It's very difficult to treat that in a single session, but XLV laser works very well, doesn't overheat the skin. So I usually use XLV for broken capillaries. We could do that when you come in on Friday. Let's see here. I know I missed a bunch of things here. Do you ever get tired of explaining things to patients? You're very good at it, clearly. I appreciate that. I really, really do. I pride myself on making sure this is as accessible as possible. I try to also tell people that like some things I just don't know every single thing right off the bat, but I'm going to look into it. I want to look at it and see, is there something else that we should look at? See if we can make sure that we could get the best possible answer for an educated, come at it with an educated approach, and really break it down simply and clearly for you. I do think that there's a lot of this within the medical field of it where it just feels as if like it's really difficult for people to have access to real experts sometimes. And there's a lot more of people who don't necessarily know the subject and talk about the subject, and they probably shouldn't. There's certain things within the medical world that I'm not an expert at, really. I'm not. And I tell patients, people will ask me a lot of times, can you look at this? Can you do this? What do you think about this? And, when they're in front of me, things like that, they say, by the way, do you know anything about that? And like, sure, do I know about it? Sure. But will I be able just to like definitively give you an answer? I will tell you if I can't definitively give you the answer, I will say that, at this point, I'll have to take a look at that, and it's okay. I think that we should like normalize that. I think we should like just say, I don't know that right now. I'll take a look and see. and I'll go through it properly and give you an expert answer after I've gone through that properly and give you an idea. If I'm still not sure, I'll still just say that that's, it's like right now, I've talked to you guys about that before. I'm still unclear about collagen supplements. I'm really unclear about that to see if it really is going to really make much of a difference. One of the patients I saw today, he comes on sometimes. I don't know if he's going to come on tonight, but he has an amazing result. Just after 1 month, his scars look amazing. And he said, should I start collagen supplements? I'm like, well, right now it's already amazing. So go for it. If you want to, I'll see if anything, it gets better with it. We'll have some more data about that. But his scars are already great without collagen supplements. Some people swear by it. Some people say they don't use it. So it's like tough for me to really know if it really is necessary for results. And it's sort of like that for a lot of different things. It's not until like we investigate this stuff ourselves sometimes, because as I was just talking about, there's physicians out there who are salespeople. That's what they are. They went to medical school. They did the same oaths that I did. They have the same supposed purpose, you would think, but it turns out that they turn into glorified salespeople at this point, and that's what they're doing. They're pushing drugs. They're pushing devices on people, and a lot of times it's like stuff that isn't needed. Like, you need to do 12 sessions of this. You need to do that. It's like all this nonsense, and they just became a sales rep. That's what they did. And they went into medicine for whatever reason. I don't know what reason they went into medicine. And now they're just coming to thinking that they're now in a superior class to patients because they went to med school, and they could kind of push people around like this. And it's really ridiculous. And it's given my field a really, really terrible name. It's really unfortunate. And you'll have doctors who are older, and they're like sad about the fact that that it's not like that as much anymore, and that people are researching more and things like that. I love the fact that people research. I want people to look into stuff. I want people to know that doing 6 to 12 sessions of microneedling for melasma is nonsense. It's useless. Don't do that. Doing a bunch of stuff like that is just useless. So I want people to know about that. I think it's useful for people, but some people are scared of that. Miriam's saying, can you get to a cure and TCA in the same day? Yes, we could. We could do that. Do any derms in Chicago have experience with PicoSure lasers? Well, if you're a derm in Chicago and you're watching me, feel free to message me and show me your results. I have a lot of people that always ask about that. I'll be happy to take a look and see if I can refer people over there. Let's see here. What's the best laser for ice pick scar? It may not necessarily be that, but we may want to do actually a TCA cross usually for that. So that's probably one of the best options there. And then maybe a little bit laser there. Mel is saying, trying to book Zoom appointment, but I can't see schedule. How long is the wait to get an appointment? I'll double check with my team tomorrow, but you may just try to submit the request, and then my team could talk to you tomorrow about that. I'll double check to see. Maybe unless it's full right now, it's possible, because right now is, by the way, our busiest time of the year right now, from now until really the end of the year, early next year. It's like the busiest time. So if you want to get in now. I am doing more things. I'm trying to do more hours. I'm coming in the morning for people earlier and things like that. I'm working a lot more to do that. So I am doing that, but just so you know, try to book right now. And we are doing, by the way, if you're acne scar patients, if you put the thing for $100 for the consultation, you are getting $200 back. So just so you know, so that's going to be really cool. And by the way, sign up for our email list, by the way, on the page, because there's some secret ones that they do that way too, by the way. Miriam saying, will one session of a cure be enough if I don't break out as much because of tretinoin? Yeah, I think so. It works really well. And, a lot of times just after a single session, it can work very, very well. Howell saying, what multifunctional laser would you recommend for a new clinic? Well, what are you trying to treat, Howell? That's the question. I get this question a lot. I have a lot of people that message me all the time about that, but it's like, what are you trying to treat? That's the question. Renat saying, I'm getting married around October 2025 just for 1 week. If you do subcision and fat grafting, is that stay in my skin for at least 1 week, so that during 1 week of my fiction, I look good? Well, you're talking about for next year. We could get it better by next year anyways. Like, we could keep it. You get to keep that. Why just do something for 1 week? Let's do it for properly. So message us. We'll try to schedule something with you. We'll see how we could do it. How long will the deal for $100 consultation, $200 be? It's going to be a limited time. I'm not sure how long they're going to do it for. They threw it out right now. I don't even know if they announced it yet. Actually, I've been jumping the gun and putting it up there for you guys. I always do it for you guys first, so you'll just get the dibs on it, be able to jump at the thing. Like I said, honestly, this is a really, really busy time. Like, everybody wants to do stuff for Christmas time. As G was saying, glow up time right now, and then on top of it, People are off. They know that they're going to be off during Thanksgiving, Christmas time. So it's like I get zeroed in around this time. It's like really fun for me. I see patients that I haven't seen in a long time actually too. It's really fun to see those guys as well. So it's like sometimes I see people only just once a year, and I see their glow up after 1 year later. It's really cool to see that actually. This is like that time of year that I get to see people. Like it's like really fun actually. I get to see like people that I've seen for over the last 6 years just once a year. It's like really cool just to see that process. So if you're one of those people, feel free to come in again this December. I always try to fit people in that are older patients too, just to put them in there. So we'll feel free to let us know. Let's see here. Smiley face. Can you show results of people you did with lasers and TCA cross, no subcision or bellow fill? Yeah, I could show someone like that. I think I have something like that on here. Although usually there's a lot of people that ultimately did it, and the time I do the result, we do it. But let's see here. Laser, TCA cross. I don't have all my results on here, so bear with me. I'll try to find something with that. Let's see here. While I'm doing that, what is the downtime of just TCA? Just 2 days, honestly. Not too bad. Can you do a cure laser the same as combination scar treatment? Wouldn't really recommend that, honestly. Just want to get your oil production under control beforehand. Usually that means oil is not fully under control. Let's see here. Who had that? I think on my page right now, what I have, everybody that I've had. Well, okay, wait. Actually, this patient before at this point, this was, yeah. Why don't we show this? Actually, this is a nice one. So this is, I did not do bellow fill at this point right here. So you can see this improvement for her scars. So I know that actually. Let me try to find someone that you can see a little more visible. Hers are relatively mild there. So let's see if I can find someone a little bit more prominent. Let's see, I'll try to find someone else too. Usually it's after the first session, so we can see that. Do you ever recommend peels? Yeah, I do recommend peels. It just depends on what's happening with patients. Yeah, that patient scars are actually similar to yours. Let's see here. I'm going to try to find someone else. Let's see here. You know what? I think everybody else at this point. Okay, wait. What was the question here for me to do? Was subcision okay? I can't remember. If subcision's okay, this patient did subcision, but we didn't do volume replacement at this point. This photo is huge. You can see, look at this. I got to reformat all my photos actually in just a moment, but let me show you this one. There we go. So there's, for some of our viewers, you can see that really well. And then I'm going to showcase, I'll minimize this one again. So this is without filler at this point. So hopefully you can see that process. Let's see if I could make it fit in the screen better here. So take a look at that. That's without filler at this point. This is subcision, this is TCA cross, this is CO2 laser. High-tech Qazi, yeah, I like it. So this is it right here. This is high-tech Qazi right here. So take a look. You can see this process right now. Yeah, this is, you saw, he came on yesterday. He's really happy. So take a look at that. So Blue's asking, how do you know if you have an issue with oil production? Usually people know, feel your skin, feel how oily it is, feel what's coming on there, the residue right there. He got so much volume back near his jaw. That's all from subcision, really. That was subcision that I ended up doing that. I ended up doing a lot. And then also the tissue did contract with laser as well. There's a way of doing it so we could get the tissue to contract as well. So it worked out really well for them. Really severe scars. He's a case with very severe scars. A lot of my patients with very severe scars don't necessarily let me do the process and don't come on here as much. So it's really nice that we have somebody who's willing to share his progress. He was saying that he did so many different things and wanted people just to learn about this and wanted people to just to learn about what you could do to achieve a great result. This is after a single session for this patient, and we have the dates. I believe it was end of February, and then he came in July. Let's see, Howell was saying skin rejuvenation, i.e. anti-aging, but what would be good for other functions regarding hyperpigmentation? Really, pico laser is really one of the best options. Kayla is saying, how long can results be expected for lasers? Really, it's your skin. You have to keep that. That's your skin. You know, you will get older though. So as you get older, you're going to need to do more lasers than just for that purpose. But that's your skin. You get to keep there. Do all lasers have a risk of volume loss? I don't think so, really. Honestly, you have to really bulk heat and stay in one spot really to do that. So I don't think that's really much of a problem there for most people there. Let's see. I know I missed there. Is there an ingredient list for the pigment control cream available? Yeah, we will send it over to you tomorrow, actually, if you need that. We'll be happy to. Let's see here. Smiley Face is saying, I was thinking of waiting for the consultation appointment until January, but do you think it'd be better to book now if my scarring is from acne around 4 months ago? Yeah, it'll be better. Let's do it earlier. Let's see here. Dr. Vongel saying, I registered online for mentoring training, but I have not heard back from anyone. How do I chase this? When did you message us? I know we get a lot of inquiries, and right now it's like my really busy time. I'll try to circle back with the team about that. But I already have somebody that's coming on, a dermatology resident's coming to me actually, I think next week actually, or wait, is it next week? I think next week he's coming over here, so that's gonna be really exciting. So he's somebody who was with me a few months ago, and he's coming back here for another rotation. Really great, a great guy, and I think he's gonna have a really great training for scars, for subcision, all those. So I think it's gonna be really helpful for him. Love when your puppy goes on live with me. Yeah, I should have my puppy come back on. I think she's really pooped for today though, so she's probably exhausted here. But Dr. Vongel, I'll try to take a look and see what's going on with that though. I'm sorry I missed the training request. I do get a lot of ones for that. Mel, I'll look forward to seeing you tomorrow too, by the way, for that consultation. I know I missed some questions. I'll try to hit everybody else's soon, but I will be back again tomorrow. What about Skin Vive used directly into acne scar that works well? Let's see here. So S. Gill is saying, I want to bring my daughter when she's off of Accutane. She'll be 15. Can you treat her scars, please? I don't actually treat scars in less than 18. I typically don't. We'll take a look and see if it's a very severe case. I may consider it, but usually I don't. There's a lot involved with scars, so I really want to make sure that it's with patients who are adults there. But we could talk, and see maybe there's topicals, things like that we may have help with. All right, guys, thank you so much. I will circle back with you tomorrow. Tomorrow we will see what else we have going on. Really a lot of fun cases, I should say. I didn't even get to talk